I don't see why the 4 people on time. I'm going to start because I don't see why the 4 of you that are on time suffer. So what we're going to do today is look at the process of aging. So I have mainly clinical people right now. I don't have any of the council people.
Yes, Karin.
Oh, Beth Ann is okay. Both of those.
I am.
Yes.
Where are you then?
Pardon?
Where are you based?
KPH.
Oh, I didn't know.
So I'm mixed up then.
Oh my God. One council.
Karine, that's what I said. That's why Karine was confusing me. You're clinical. No, Karine?
No, counselor.
Council?
That's what I told you.
Yeah, she said she was counsel.
Council, but she's based at KPH, and their family is also
Beth Ann is counsel.
council. George is clinical from Bahamas.
So what's the name of the nurse? What's the name of the nurse?
Selma.
Ah, that's what I'm doing. I'm getting mixed up. Karine, I thought you were in the Bahamas. Okay, the reason for finding out who we have is to see how clinical I go and how clinical I don't go. So we will make sure that the lecture is relevant for everybody. So we're going to talk about the process of aging today. Why am I not moving, Dwayne? That's what I was doing. Okay, so we're going to look at the process of aging today, and particularly the biological changes. You haven't done the sociological yet with Julian, have you? Okay, so it's very important to link this lecture with the social lecture because you will see some of what's that now? Is she speaking or? She needs to mute.
You can't have all my.
Yes, we've done arranging with Dr. Julian. We have.
Okay, good. Okay, you've done it. So where we overlap, I will mention it. So I love Mark Twain, and Mark Twain says it's really an issue of mind over matter. If you don't mind, it won't matter, or it doesn't matter. So, and you're only as old as you feel. That's very true. I'm reminded of this because I lost 2 patients this week. One was 98, and the daughter is as happy as a lark. Not that she is gone, but that she went in her sleep peacefully, and that this, and we reminisced on it yesterday when I did the death certificate. She came to me over 10 years ago, having had heart failure and an MI. We had done all of the digoxin, Lasix, the works. And the daughter is very satisfied that she got her through the next 10 years, very comfortable. In fact, the note in my docket says it was February of this year that she began to get a little bit shaky. In fact, I actually had to see her in the car. The walk was too much. But you know, if you can get from 88 with a heart attack and heart failure to 98, still, I can understand why the daughter was happy. So it's a normal part of life. It begins the actual aging process in terms of changes. Begins somewhere around age 30. while we say that it begins at birth, if we think of aging as changes and loss of cells, etc., the loss part does not begin till around age 30. I'm not contradicting what I said in the earlier lecture about aging being a process that begins, because it's aging for you to go from childhood to adolescence, etc. But the actual biological changes we start seeing around 30. And I love what Pip, there's a lot of things, signs with this on it. Pip, if I'd known I was going to live this long, I would have taken better care of myself. And this is really about emphasizing that aging is a lifelong process and you do have some control. So who are these old people we talk about, or us old people? We have young old, and there's actually some adjustments to this now. So you have young old, which is 60 to 74, often thought of the new 50, because people at 60 and 65 and 70 are really not old if nothing is wrong with them. Then you have the middle old, 75 to 84, where you can begin to see some of the changes, some of the muscle mass loss, etc. And then the really old ones, which are 85 and older. What happens? Please do.
Hi, everyone. Are you seeing pro size? Are you seeing the change?
No.
So you were going to sit there silently and not say anything? Oh, you knew.
Because I'm in the class watching.
And you're not seeing them.
Yeah.
You're seeing it now.
You're seeing it now? Okay, great. All right.
Oh, sorry, I'm all right with over there.
Bring this up. So here. And let's make sure it's working before I leave. Okay.
Yes, I'm seeing it.
All right, so this was the one that you missed with Pip. If I'd known I was going to live this long, I'd have taken better care of myself. And that little old man down in the corner is called Pip. Not sure why. And then we did this. By 2030, for all of us, the Bahamas included, you're going to see an increase in that older population. That 80 and over is where you're going to see the biggest increase in the 60 and over population. Aging is a process of change. It's not a disease, nor does it cause disease. As I told you before, it's the risk factors that cause the disease. And it reduces one thing aging does do is reduce the body's reserve and the ability to respond to stress. So somebody with flu takes 3 weeks to get better instead of 3 days, which was when you were 20 or 30. People who go in for heart failure, etc., just take that much longer. We know that aging changes take place at the cellular level. And you think of the skin, you think of the dry skin, you think of the cracking skin. You can think of the fact that things go through the kidney much slower, things go through the liver much slower, and you need to know all of this. For those of you who are from the social sciences background, this is going to impact other things. We're talking, when we say kidney and liver, the clinical people, we're thinking medications. But the same thing's going to happen for people when they're eating. Things are going to go through the stomach much slower. And I'm sure those of you who work with the council, you have a lot of your 80-odd-year-olds, the family members telling you they're not eating as well, that everything is slowing down. So everything that I'm saying is applying to all of you. Cells basically just function less well as you get older. Thelma is here now. Some cells get damaged, some regenerate, and some die. And it will depend on the degree of illness and disease whether cells can recover or cells can die. And I have a young man that's connected to our family via my brother's help, and it really reminds you about youth. He was squashed, and there's no other word for it, by a forklift about 2-3 months ago at his summer job. And what's amazing is that she called me this morning very excited. He's still in ICU. He stood up with a walker. Now, I can't think of somebody 60 being able to do that. The body, he went into kidney failure, because of the blood and all of that and the low pressure. But it just means that that's a good example of aging, because I think that if somebody 60, 70 got their leg crushed and had to have it removed, we probably wouldn't be saying they stood up with a walker. So we recognize that cellular function is very much a function of age as well. And this is what this is saying. The decline in organ function is not as dramatic as the decline in cell function. And depending on where you are, so for somebody like Thelma in the hospital with a lot of people in bed, etc., and for you in the council with people that are in bed at home, you're going to find that the cellular changes, especially in the skin, are going to give you a lot of issues to deal with, the bed sores. One of the things I've found here in recent times, with all of the increased awareness, these people will bruise very easily. Are they being abused by a family member, or is it just because there are some families that I know, and I know there's no abuse, but just holding on to help them get up. And when and I see Thelma nodding, you see this massive bruise, and of course you see 4 fingerprints, and you really have to wonder. So it's really about knowing your people, your clients, your patients, etc. So we talk about normal or usual aging, which is what we're talking about today, that these changes are going to occur in most people, it happens to people differently. And here you have my 98-year-old going. I lost another one this week, and she's nowhere near that, but she had a stroke and all kinds of things. And she also had dementia, and then had a massive stroke about 10 days ago. Interestingly enough, in both situations, one was a son, one was a daughter, both felt good. And in many ways, both had done different things. The son obviously can't take care of our mother in terms of bathing and all of that. But he actually lived in the States and actually came home to be with her, and has been here for the last 4 years looking after her. So he had to do the other things like the power of attorney, etc. So he told me when I spoke to him yesterday that at least he showed her, what was his words? I thought they were good. I was able to do for her what she did for me many, many years ago when she was bringing me up. And he said, just being able to make her comfortable the way she made him comfortable when he was little, that was the greatest joy he got. So people just see it differently. But clinicians and social workers have to know what the aging changes are. If you don't know, like what I just said about older people's skin getting fragile, etc., particularly the social workers may well jump to the conclusion that every bruise that they see is abuse. And you have to know that older people bruise more easily. But then you have to be suspicious. And as a social worker, you would have to be trying to make sure, because we can usually, by using your eyes and seeing how they speak to people, etc.
Body language. Mm-hmm.
What was that, Bethan?
No, I was just saying how they behave.
Right,
For observation, you'll know if they've been abused or what.
Very good point. And you'll also see like how they react to people, because you
Yeah.
can, you know, do they shy,
Right.
exactly.
Withdrawn. Right, the same thing.
Okay, so we have various words that we use. Senescence is something linked to senility, and some people use it negatively to talk about the changes. But it's a group of effects that will lead, if you are not managing them, will lead to a decreased expectation of life. And of course, when you come to 85, etc., these things begin to be overpowering and to take away years. Remember that maximum expected life is 120. And not many people get there. So it is illness and what we do to cells that causes us not to get to 120. So it differs from other biological processes. The characteristics are universal, i.e. cells die, cells get damaged, etc. The changes are from within. Even if there are external processes such as the environment, etc., the actual change is from within. Associated processes occur gradually. A good example of that is problems with the joints, arthritis, which is cell damage. I mean, if you look at in any of the textbooks or online on Google, you can look at a joint that's normal versus a joint that's not. Now, it takes a while for that process. Changes can have a bad effect on the individual. Ultimately, you're going to die no matter what you do.
Yes, it's inevitable.
Ultimately, you're going to die. And this is important to recognize. So it's really about the quality of life. You notice that the daughter stressed that for 9 of the 10 years post-stroke, etc., her mother was fine. Going to church, and she was blind, you know, she had been blind for a while, but she didn't let the blindness get to her. We had long conversations. Right up until the last time I saw her, she was very aware of me. And she would pray for me each time she left my office. As I say, about February, you could tell those muscles on the, and she was tiny to begin with. This woman never weighed more than 100 pounds at best. And with all of the muscle mass loss, etc., she went down to 80 odd. But in February of this year, you began to see it. But that's 97, because she was 98 in August. So you see these kind of things. There's nothing you can do about it. You have causes of death that come from cell damage, etc., heart disease, stroke, diabetes. And we know that the biological changes happen more aggressively between 60 and 70 in older men than women. We have a theory. Older women in general access healthcare earlier.
Yeah.
Women are going to health centers for their hypertension, etc. Men wait until they're admitted to hospital via their heart attack and their stroke. So these are things to think about. So just some general points on your physical aging is that, and we've been highlighting that in the conversation, there is great individual variability, even within families. Systems will generally maintain competence, even though they lose their maximum. So you'll have people that are fine until they get something that stresses the heart. And I want to stress here that the stresses on the heart and the body systems are not limited to clinical. The loss of a loved one, the loss of a child, the loss of your house, all these kind of things can stress you and put you over the brink. Several factors, and we've talked about them: the biological change, the disease, the environment. You have to think about the environment in today's world as well, because you have people in areas where they can't come out. You can't come out after 4 o'clock. You're closed in. You're shutting the windows. The environment is all of these kind of things. And of course, your personal attitude. How are you going to accept all of these changes. The changes themselves are not diseases, but they can predispose. Because if your immune system is down, if you're always fatigued, then you are going to catch an infection easier, etc. And of course, physical changes have important implications for any psychological functioning. So the message is that all people age, but not at the same rate. And just think about how people look. Some look old and are not old. And you can't judge. I will never forget, this would have been 20 years ago, and I gave what I thought was an old lady a wheelchair. I really thought she was an old lady. It was in the Salvation Army's thing. And she was moving about in the wheelchair, and I realized she was still having her period because there was blood. And believe me, I thought the lady was well in her 60s. She was only 48, but living on the street and hard time. But that woman was so independent. I've never forgotten it. It was Christmas, because it was the Christmas thing, and she was on the street. Well, first of all, she told me what time I could come. And the man from the Salvation Army told me yes, because there's a business down here where she bathes, but it's not open till 9 o'clock. So she was getting a wheelchair. People were coming to see her. She had to be properly dressed. And then I said to her, "Are you okay on the street?" She had her dog with her. I'll never forget the dog. And I asked her if she was okay on the street. I said, "Do you want to go to the Golden Age home, which is our residential facility, for the holiday?" I was very specific. And the lady looked at me and told me that if it's a condition of your giving me this wheelchair that I go to the home, you can have back the wheelchair. That's how independent she was. So I said, no, I'm giving you the wheelchair. I'm just saying, since nobody will be around to feed you, etc., because it's Christmas. Jamaica locks down at Christmas. Boxing Day is a holiday. Well, she wasn't having any of it, and she stayed on the street. And the Salvation man told me that people will come and feed her.
Did she have mental illness?
I don't think so. She was very rational with me. They get fiercely independent. So there are changes in both body and mind, and we will run through some of them, but you will see them in the skin, the bones, the joints, urinary tract, heart, eyesight, hearing, sexual changes, body comfort. There are some changes in the brain, and we're going to go through these because adaptability is not. There can be memory changes. Please remember the slide, this one. For these two slides, I should have put this at the bottom of both so that you understand that everybody is different, which also means that you have to assess everybody. Whether it's a clinical assessment or a social assessment, you've got to, and you can't prejudge. You can't prejudge. So let us look at some of the particular changes that will impact life. As I've said, there may be no changes in baseline. They may still be able to do various things, but they will not be able to adapt to stress, even if they did so when they were younger. And various body systems lose reserves quicker than others. So this one is repeating. What's happening here? Okay, so at average, just to show you some of what we can expect, 75 compared to 30. You see, it's a wide comparison. The brain actually does shrink a little bit, even when there's no loss of brain cells in terms to impact various things. There's some shrinkage. 84% of BMI, basal metabolic rate. So you will find that older people will tire more easily. But look what happens to kidney. Now that one is significant. So that's why they have to go pee more often, because the filtration rate, they lose it. So they actually go more. because they're only taking out 70% of the waste compared to earlier days with 100%. We lose lung capacity, and we lose lung capacity really because we allow ourselves to lose it. Watch older people breathing and look at how shallow it is compared to younger people. And if you give them that incentive barometer that we have where you have to blow and raise the thing, they can actually get back a lot of that power. And we're simply not the people we were when we were 30. I must be the only one. I won't ask Selma how old she is. But you can comment after I comment in case you want to join in. I notice a big difference between about 40 and 60. When I had things to do, it didn't matter if I went to bed or not. Now I have to go to bed and get up at 5 because I'm not concentrating at 9, 10 o'clock in the night if I've worked out. There's a definite difference. I get tired a lot easier now than 20 years ago. These young ones in here are nodding their head like, I don't know what they're talking about, you know.
How old do I look, doctor?
I'm not sure. I'm not sure. How old are you?
I'm 54.
I didn't think you were that old. That's why I see? What? I'm getting 2 watts in here.
Yes, 54. I'll be 55.
Something like 42.
I'm hearing 42 in here, so take a bow, girl. So so you're halfway between me and 40. Have you noticed any changes?
Yes, a lot in terms of energy. I used to be described as rambunctious and always going, and now I have to take maybe 1 or 2 activities at a time.
So this is normal, and it means you need to plan for it. You know? What's that?
I was saying, what about your sight, your eyesight? I mean, that tends to deteriorate as well.
But that's much earlier. We call them the passporting glasses. I'm talking about in the overall body. The eyes is a different, it's by itself.
Okay.
But the eyes also compensate because as you become more short-sighted, you can actually are better long-sighted. And the other thing with eyes, if you have cataracts, you take them off and you're perfect again. Because I wore seeing glasses for 50 years. And now I have 20/20 vision without glasses. Wow. So there's some positives to it, let me warn you. So these are things that you have to think about. So this is really just for you for the PowerPoint so that when you're thinking of the changes, you have an overview. And this is the one that I like better. Because it sort of brings out, it makes you think. Because we say the kidney, but we don't necessarily focus in on the bladder, etc. So this picture is more the change, what happens. And then this one summarizes. So the skull thickens, the head side increases, the hair goes gray and becomes thinner. That I found 2 things happened with my hair. And what was very interesting, because don't ever say once a man, twice a child to me. But my hair color changed at puberty. I was very blonde until 14. And I showed everybody my passport, my childhood passport, and they couldn't believe it. So my hair color changed, and it changed again at menopause. Went quite dark, and then got lighter again before it became gray. So you can see the hormonal links. And I used to have a tremendous head of hair. And it definitely started thinning after menopause. So it didn't wait for 60. So you do see the changes, and I'm sure that if you talk to, Thelma, are you seeing any changes in hair?
In my hair?
Yes.
Oh yeah. Don't worry, don't mind this looking black, this dye.
See? And is it getting any thinner?
I guess I'm somewhat around the edges mainly,
But you haven't got the thing. I mean, when my hair was so thick and so unruly that when my mother was pregnant with her third and fourth child, my father made her cut my hair because I was giving her too much trouble running around in the morning to plait it to go to school. So, and I remember that. So these are the sort of changes, but it's very important. Why am I spending time? Because people will say my hair is getting thin. Is something wrong with me? What can you do? There's nothing you can do. So these are things you want to talk about. Think about. The bones become less dense. You get the wear and tear on the joints, the breakdown of the cartilage, etc. And the other, what is that? Is that her hand or her foot? That's her foot. That's the hand. Okay, this is you can't forget the sensory system, because I'm sure when you did the social changes, you have to see things, you have to hear things. Appetite is related to smell. So the sensory system is all very, very important. So when you're thinking about biological changes, the sort of exam question that you will get is, how can the biological changes affect the social changes? So I want you to be thinking about that. Clearly, if you are losing taste buds, etc., in your tongue, and you are losing your sense of smell, going out to eat can be less fun. If you're not enjoying the food, why go out? So I want you, as we're going through this, to think, and Thelma, this would be important for you as well with the home, the hospital. Why do your residents not want to do X, Y, and Z? Is it that they're not enjoying it? If you can't see, why bother go sit down to watch television? If you can't hear, why come and watch the radio? So you might be thinking, and you, from the council, people, and I get this all the time from relatives, but they don't want to participate. I'll share with you, and it's an important lesson. My mother had a problem. So my diagnosis was that she was demented, because my mother kept telling me that we didn't tell her things. She would be there and she would get really upset and really annoyed because so-and-so would have had a baby or so-and-so would have got married and none of you told me. And get very irate with us. So we had this conversation in the family. My sister's a physiotherapist, so we label mommy demented. One day we're actually physically face to face. She lived in Montego Bay, I'm in Kingston, my sister's in America. So a lot of these conversations were by telephone. And we're there talking to her and we realize that she's not hearing us. But the answers are not appropriate. But she's saying yes and she's nodding her head. So eventually we called her out on it. We said, Mommy, what did we say? Well, she didn't have a clue. She didn't have a clue. So we got upset with her. We said, but Mommy, why didn't you say anything? Well, all you all are going to do is rough me up. And she said, I'm tired of saying, excuse me, can you repeat yourself? So Mommy was not actually demented. She had not heard what we said. You can't remember what you haven't heard. And the minute we got her a hearing aid, it was a different matter. She started participating. So I actually had some conversations with her. And she said, there's no point going out because I can't interact. So I can't, because I don't hear, especially if there's noise, like if you're going to a cocktail party or not even church, she would go because the piano, she couldn't hear the sermon because of the peripheral noises. So trust me, your sensory system can really impact on your interaction with the outside world. So when we talk about, and Thelma just gave us a beautiful example of it when she said it looks black, but it's dye. So if you ask outside people not who have not studied gerontology, what most represents aging, they will tell you that it's graying hair.
Yeah.
I mean, we talk about the wisdom of age by the color of the hair. My mother argued with me for years, why wouldn't I dye my hair? And I said, Mommy, I don't have the time. I said, I can't stand when roots are showing, so I'm not even going to go there. But people really measure aging according to the skin. Muscles of the face are capable of tremendous movement. And you really find that time. Dr. Gopi is there looking and massaging his chin with his skin thing. And people show you their neck and you see the fine lines called laughter lines. Some people wear them well, some people don't wear them well. They get all upset about them. But what I find incredible, Black people don't get lines. It's amazing. Very few Black people. Look at some of these Black faces that we have. Look at the ones that are in the pictures in the aging center. And just look at some of your relatives that you know are 75. How many wrinkles do they have? They'll have laughter lines, etc. But Black skin does well. But you do get the loss of subcutaneous fat. So the vulnerability to pressure sores. This is what I was talking about in terms of the bruising, etc. Because you've lost that layer of fat. And if you notice, arms will hang down, that sort of thing. For those who are traveling, they feel hot and cold even more because the subcutaneous fat is a lovely protector. They don't sweat like they used to because you're losing the sweat glands. The next one, of course, is the one that is particularly traumatic to anybody, whether nursing or social work, the thickening of those toenails. The fingernails are not as bad, but they get these long hooked toenails that are almost impossible to cut. Yes. And when you try cutting them, you are at real risk if you don't know what you're doing. Yeah. I've actually had a lady end up with amputation because she was diabetic. And the caregiver in the nursing home, and this was in a nursing home, didn't realize that she had cut the quick. And of course, going back to the slide before, old people feel hot and cold. So a lot of them wear socks. So if you're diabetic, you have decreased sensation, you have a little cut in your quick of your toe, the next thing 3 weeks down the road is the gangrene smell. So
an experience that I had when I was in Barbados, somebody told me that at the Diabetes Association, so that this lady wore slippers when she traveled, a little place she wore slippers, and she was there walking, and didn't realize that the slippers was off her feet.
Wow.
And she was diabetic, and they had to amputate her leg because it got so sores. And I mean, she didn't know because she was diabetic, and at the end they had to amputate her leg.
You know, it's interesting that you say that. I couldn't understand why my sister is always fussing about those of us that wear the no back slippers. I'm always in a former slipper. And she says the same thing. Once you are older, you must have a strap at the back because you'll walk out with shoes. She apparently has seen it a lot in Alabama, where they can actually walk out. So post-surgery, for anything, knee replacement or hip replacement, they will not let you wear a slipper that does not have a strap at the back.
Yeah.
Yeah. And of course, if you're diabetic, you can understand how you wouldn't feel that you'd walked out the shoes.
Exactly.
And then you're not feeling the heat on the pavement. Step on something, exactly. Okay, so you've got the message, and we've talked about the graying hair. And this is what you were saying. For the eye, there's diminished vision.
Yeah.
This is called past 40 glasses, though. There's night blindness, there's diminished hearing. We're just summarizing actually what I spoke about. The decreased taste and smell. And we see
one issue there before, you said decreased taste. Isn't it possible also your taste can also heighten? Well, I don't know. Is that the way? For example, persons who their taste, well, I guess it comes in the same. Yeah.
it's decreased, and what happens is that people tell you they want all the taste is very important to eating. Taste and the appearance, actually. People like to know how it looks. And what happens is that older people, for some reason, insist that sugar will help, and sugar won't help because sweet is one of the ones that go early. What will actually help is bitter. So any of the sauces, pick a pepper sauce, not necessarily a pepper sauce, but if you have like a tamarind sauce, anything that has a little bit of oomph to it will improve the flavor. More onion, more scallion, that sort of thing. So I think people just assume, I mean, when you're a child, you like things sweet, or yes, I never did. So people sort of carry forward that, well, okay, if it don't taste good, let me put some more sugar. And that's a problem because the increased sugar, because sugar goes early, because it's at the front of the tongue, you won't get it. Now, the problem with all of this, of course, is that these are not often reported to a physician or their primary care provider. And in our social work, we don't tell people in doing their assessments so that you can tell the family, etc. How often do you really assess hearing and vision? And it's easy to assess hearing because all you have to do is stand up behind the person and see if they hear you or not, if you whisper or what. But it's going to limit the ability to function for reasons that I've just said. Social isolation, ability to communicate, we've just done all of this. And I just told you that it may appear demented. So it also means, and here again we go, linking the biological changes, the physical changes to your social changes, the social deprivation. Everybody, we're all creatures of interaction. Maslow's hierarchy of needs doesn't go, perhaps it goes, I'm not even sure it goes for demented people because they appear to, or for persons with dementia, because they appear to be doing some sort of gratification. And you have people that love their animals, etc. So I don't even think it goes for persons who develop dementia. So being there and not able to interact is going to cause loneliness. Also, it's going to cause an increased risk for falls. Because if you're not seeing properly, if you're not balancing properly, and remember, skin is also a balance organ. You just described the lady beautifully that because of the loss of nerve endings in her foot, well, that lady is also not going to know where her foot is.
Right.
And you need your proprioception to be able to balance. And clearly, overall, a decreased quality of life. The skeletal-muscular system changes perhaps affect, I'm not sure if joints and bones or your digestive system discombobulate life more. But clearly arthritis and muscular conditions, again, falls, social isolation, can't get in and out of a car, that sort of thing. And let me tell you, it's not only here. I was in England and this must have been what, 10 years ago, because I haven't been there for that. And if you think it's just our buses that are a nightmare, those red buses in England, the steps are even higher. And the steps are at the back. And I actually watched a little old lady be dragged down the road.
Okay.
Because the bus driver says you take 2 minutes to come off. Of course, she took 5.
Yeah.
So he moved off. Right in that main street of London. So it's not just, and everybody is shouting at him and he's not understanding this little old lady is half caught between the step and the ground. Exactly. So we have, again, it's about sensitization. It's about helping people to understand. Arthritis, we all know it. My old people, my seniors in the National Council tell me it's not arthritis, it's wrongness, because there's absolutely nothing right about it. It's wrong. And you don't call it arthritis. So you have a whole set of people who call it wrongness. So it's one of the oldest diseases. We don't know the cause. Well, we know weight contributes. But you have rheumatoid arthritis, which is different, which is genetic. But it's a degenerative disease. It's a gradual wearing away of the joint, and it can do damage to your ligaments. Again, well, rheumatoid I mentioned, which is an inflammatory disease. But again, you will see the link between arthritis and social, because if you are in constant pain, how are you going to go places? You have people that stop going to church, and going to church is critical for a lot of old people. It's their social activity for the week. And the osteoporosis, which is the loss of the skeletal mass, many are asymptomatic, but what it means is that they're at higher risk. Look at how many times you will hear of an older person that has broken their arm breaking a fall.
Yeah.
And they would have fallen 1,000,001 times and nothing happened. And then once the osteopenia steps in and they put out their hand to break the fall, they have a broken hand. So these are the things you want to talk about. The sarcopenia, which everybody is talking about now, it's a new in thing. Mark, it's only affecting 2% of the population. And it's the loss of muscle mass that comes with aging. But you, again, important to, if you can see it, and you can actually see the muscle mass, because it is reversible with exercise. So it's critical to know about it. So what does all of the musculoskeletal mean? Chronic pain, decrease in function, lack of independence, which all are going to affect social. So, to me, this is one of the most significant ones that we have to think about. I had a lady and she came to me, obvious heart failure, huffing and puffing and couldn't go anywhere, swollen. I said, what's wrong? My knees are hurting. Can you go on the bed for me? Why am I going on the bed for my knees? Don't you have shortness of breath? Not bothering me. I had to bargain with that lady because she was obviously in heart failure, and I had to treat her heart failure. Obviously, because if we'd done anything about her knees, our heart was going to prevent her from walking anyhow. She said to me, that's not what I came here for, and I'm not paying you. I'm not paying you today because you're not looking after what I came to see you about. And eventually we had to bargain. So she was to go and do her blood test and do what she had to do, and she was to come back in 3 weeks' time. And she said to me before she left me, and you're going to look about my knees, and that's a free visit because that's this visit. And she did turn up in 3 weeks' time for her knees, and she did tell me she was not paying me. This is the other one, and as I say, I'm never too sure which one gives more trouble. And one with one seems to have both. What are you doing, Dwayne?
Working on something else, so that's ignore me.
Ignore you.
Yes.
Oh. Okay, so everything in the GI system slows down. So a lot of older people will tell you they feel full. And this drives relatives crazy because relatives know you used to eat a plate of food. Now you're eating a side plate of food. But it's real. The decreased motility and the loss of strength, the food sits there. A lot of older people will not eat food after 3 o'clock in the afternoon. People who used to eat a big dinner. Give them their dinner at lunchtime and they are fine. So these are changes. And this is a common referral. I'm not too sure about this referral story. I have one lady who tell me that when she gets bloated, all she has to do is rub her knee. I'm not too sure how the knee relieves it. And when she rubs her knee, she makes a big belch. So they will tell you different things. So you have to work them through when they complain about these things. But, and I don't know if it's true in the Bahamas. The current cohort of older people, which is of course 4 or 5 cohorts, also have a notion in their head that they have to have a bowel action every day. So they will, anything that is wrong with them, it's that they did not have a proper bowel action. So you also have to take into consideration culture. I had one of my first patients, so I'm going back to 83, and she was clearly dying, a heart failure patient who was clearly dying. And every morning she insisted on her milk of magnesia. That picture of her sitting on a commode with the milk of magnesia just going straight through her, because she just was, the dying process took about 10 days. And I would go each day so as to support the family, etc. Those last few days where this milk of, and she taking her milk of magnesia, nothing else, not even water, but she had to have a bowel action. So you also have to work within culture here. So constipation is very common, and you cannot convince them that they don't have to go every day. And even when for some reason, whether illness, whether chronic or an infectious, and they're not eating, they still have to go, so you have to give them a laxative. It drives me crazy, because then you have to worry about the dehydration and everything else. Remember what we said about shrinkage of muscles and all of those kind of things. That happens in the mouth as well. Have you ever noticed when you're talking to some of them, they look like the denture is about to come flying out the mouth at you? And we also had a lady in the council. She was from Marcus Garvey's family. She was a direct relative. She used to take her, you give her something to eat, and the hand went to the mouth. And I could never understand what was happening. She was taking out the denture to eat. She was actually more comfortable chewing on the gums. So these poor fitting dentures, increase in heartburn, everything. And they will, there's a possibility, if not frank malnutrition, certainly subclinical. The heart, in the absence of disease, actually the heart does well. The heart is one of the ones that the changes are actually quite minimal. Blood pressure will go up a little bit with age, but it also tends to stabilize. But just look at how it's important. We tend to think heart. We don't tend to think cardiovascular. Please remember that blood has to get to the head. Blood has to get to the lungs, kidneys, everywhere. So you want to think of the atherosclerosis, the high cholesterol, for in layman's language, because we are beginning to see quite a bit of that. Please remember that if you have plaques, etc., in your aorta, etc., you're going to have them going up into your head as well. So when we're thinking of this, we are also thinking of it affecting the brain. Okay, and the arteriosclerosis, which is a loss of elasticity. You can have a loss of elasticity without cholesterol plaques being laid down. And people will tell you that they hear their heart beating, especially in their neck when they're sleeping. And trying to reassure people that there's nothing wrong with them is difficult, because you can hear your heart, and that's the loss of elasticity. So it means a decrease in capacity to cope. They mow half the lawn instead of the whole lawn, and they get very annoyed with themselves because they used to cut the whole of the grass. Now they can only cut half. Simple tasks become less achievable, carrying out and hanging out the clothes, etc. But you also get things like changes in strength because of the arthritis, and many times they can't open jars, they can't use the opener to do that. Again, you are going to have an impact on social living. Suppose you live alone and you are dependent on the sardines and the mackerel and the tin stuff because you're not cooking. If you start getting these problems with heart, or because remember, you can get out of breath though, but especially with heart wrongness, then you are going to see issues. If you go back to the first slide that we spoke about, you remember, well, not the first, somewhere down when I said the changes. The respiratory system is one of the most affected in terms of loss of cells and things. So then you put on top of it the loss of elasticity, the loss of secretions. Remember, we went back to the secretions in the mouth. That's why they don't like to eat dry food either, the secretions in the mouth. I should have mentioned that. Right, they don't like it. And then you have young people saying you mustn't drink anything while you're eating. They'll choke and it will go down in the lungs. So you find that the abdominal muscles, if you think about the number of things that can affect the chest, because there's the loss of the elasticity, but there's also your muscles. Remember, you have to, the diaphragm and all those muscles have to be in good shape for you to take a deep breath. So it's much easier to just take these shallow little breaths. So they can't do exercise the way they used to. They are also more prone to infection because the cough reflex decreases as you get older. So when things go down, they don't cough them out. So they're more susceptible to pneumonia. So there's a role for immunizations. And for TB, they get the viral infections and they all want you to give them antibiotics for the infection. And of course, it's not going to get the viral infection better. But it's very difficult to differentiate between the aging process and the environment. And this day and age, with all the things floating around in the environment, it becomes particularly important. Then we need to think about the nervous system. This system regulates mobility, sensory information, cognition. Your nervous system is an extremely important system. And remember what we said about cells dying, etc. So you want to preserve this as much as possible. However, memory, let's get some definitions out of the way and let's not assume that all aging changes impact memory, etc. Memory is your mental capacity to retain or recall facts. Now, for you to retain, and just think of mommy, the first thing is you have to hear. You can't retain something you haven't heard. A lot of people do lip reading. A lot of older people have to see to hear. So if vision and hearing are impaired, then you're going to affect the ability to receive the information. You can't remember what you didn't receive. What is also very important, I have found with older people, if they're not interested, they won't even try and retain it. They'll just block you out. They'll just block you out. So a lot of them don't, if you ask them, did they listen to the news? Yes. Did you hear about the killing? No. Because they block it out. They don't want to hear. They don't want to get upset. Same thing when you're telling them family news. If it's not something they're interested in, they just block you out. So don't think they're always forgetting. You have to be interested. And of course, there's long-term memory that goes last. It also means you have to have no damage to your brain, because where you store, where you retrieve from, where you also, when you get a message and it goes into the brain, you have to interpret that message as well, which is why you think you told them one thing, but what they do, etc., is another thing. And this isn't normal people. So what happens is that as people age, they will have more and more difficulty with short-term recall. Please notice that the word there is difficulty. Have you noticed with older people, and we're talking here a lot of those over 75, not so much the 60 to 75. Have you ever noticed that when you say something to them, they pause even if you're doing, for the doctors in here, if you're doing the mini mental, have you noticed you will give them something? Take 7 from 100, and they actually take a minute or two to do it.
Yeah.
And it's because it's slower. It's not that they're demented or early dementia. It's the brain just works a little slower.
Yeah.
Intelligence does not change. Do not assume old people are stupid. What it is that they have been through life's experiences, and well, I don't know about you, but I'm going to speak for Thelma and I. If you do something and it works and it gets you to the point you're at, why must I try something new? If I know if cooking rice and peas is doing it and I'm doing it with coconut, why you want me to use the pack of coconut thing that you bring from the supermarket? I know it tastes good when I grate my coconut, and now I can put my coconut in a blender. Why must I do it the new way? So it's not that intelligence, it's not that we can't learn. It's that we don't want to. And we don't want to because what we have done in the past worked for us. I remember we were having a discussion, one of the old ladies from the council, and I wasn't yet 60. And people were talking about how young people dress. And she was laughing her head off. She says, nothing has changed. She says, well, when the mini came in the 60s and the late 50s into the 60s, she said, don't you think we all had a heart attack when our children came into the house with a skirt above their knee? All that's different is it's now gone right up to the hip. And you know, I stopped to think about it. And when you look at how fashions have changed, grandparents made as much fuss in the 60s and the 70s as we are now making about what young people are wearing. It's just that it's a little different.
Tight pants for the men.
This pass it on the hip.
No, the tight pants.
Or the tight pants.
When I was my father's pants back in the day, they used to call it gun mouth pants, but it is the same thing.
Same thing. So things go in cycle, exactly. So it's a factor of motivation, but I want you to assume they are still intelligent. Behavior doesn't change, or what causes behavior? Behavior is a response to an event. Now, you may perceive the event a different way, but even for people with mental health issues, a behavior is a response. They don't like the person has done something that they have taken offense to, and it may not be, remember I said people with mental health issues, it may not be that you should take offense, but in their mind of misinterpreting. But I promise you, behavior, if you are dealing with anybody with a mental health issue, try and find out what's causing the behavior. It has a meaning, it doesn't happen. It's intended to satisfy human need, self-actualization, etc. Behavior is learned. We learn to do things, it will get a response. If it is about complaining to your children, if it is about demanding to see the doctor, it is to get attention. So behavior is predictable and it's measurable. So the senior's reaction to his or her caregiver can also cause certain behaviors. I have a patient who is 99 and 6 months, 100 next May. And I'm very nervous. He has 2 caregivers. And the caregiver that I like has gone away for 3 months. And I said to his son, I said, I just wish she would come back. I think you need to get her back here and tell her she can't travel till next May. When she's here, he's a different human being. But she kisses him, she hugs, you'd believe it's his granddaughter, the way she treats him. He's given her trouble, he really has lost a lot of muscle mass. So he's sitting in the office and he don't want to get up, she just lifts him and carries him. has no problem getting him to bathe. The other one just bullies him. And I can't wait for, we need to get him till next May. The son has booked his ticket for next May. You hear me? The son is a professor in England. He has booked his ticket for the party next May. I need to keep Mr. Jackson going till next May. But I need that caregiver to come back. But caregivers can be when my father was sick, he had a caregiver that I couldn't stand. I called her Miss Magoo. She had no sense. The next thing my father tells me, she's going to Montego Bay with him. Miss Magoo did anything that Daddy asked her to do. Daddy had Miss Magoo round his little finger. So of course he loved her. She went to Montego Bay with him. Miss Magoo would get up at 2 o'clock in the morning and would give Daddy whatever he wanted. I had no control of Miss Magoo. No wonder Daddy loved her. I couldn't give her any instructions. She says, but nothing is wrong with Doc's head. Well, something was wrong with Doc's head. She didn't accept that anything was wrong. It had a stroke. So these are things to think about. Personality is not really affected by the aging process. Personality is what's that?
You were saying behavior is predictable and measurable. How is it measurable? I didn't understand that part.
If somebody does something, you can measure it. You can measure how many times. You can measure if they do it every time to that same stimulus.
Okay.
You know, do they always fuss when they're going to bathe?
Okay.
Or is it when certain people are going to bathe them?
Okay.
So you can do it. So personality is a collection of qualities. Personality starts forming from childhood. There is no such thing as a stubborn old person or a difficult old person. My next question when the relative tells me that they were stubborn or difficult, well, what were they like when you were younger? Same way. Stubborn people get old, difficult people get old. Old people don't get stubborn and difficult. So your personality can become more accentuated. Take it over into the psychological. Think about it. If you have been somebody who doesn't cope well with stresses of life, etc., who gets hysterical if it rains outside. I have a hysterical sister-in-law. She gets hysterical about everything. But you know she's going to get hysterical. Trust me now that she's 70, she's worse. So now, and this is what I mean about behavior. So now you know she's going to overreact. So you put things in motion to not let her overreact. Because she has a heart of gold. I love her dearly. But she was always like that. And her mother is like that as well. Her mother is 94. So there's some things you don't tell her. Because she's going to have a heart attack. So these are the sort of things you want to think about. Learning is lifelong. It's about transforming knowledge. And except for persons with dementia, people can learn. What it is that the older people don't necessarily want to learn. Look how many of them have learned to use the computer because some grandchild is abroad that they want to Skype. Yeah. They're not learning the computer to be able to do Google searches, you know. They are doing the computer to be able to talk to their grandchildren.
Right.
Right? When we start, what's that, Bethan?
Even with the phones today, the changing of the phones.
That's right.
Yeah, because they just adamant that they want a banger. They just stick to one set of phone. Despite
hey, you're talking to me. I nearly died when BlackBerry stopped doing Blackberries. I was so mad. So mad. I bought 2 phones and sold them back, trying to get a phone that worked like a back. Worse when I didn't have anything to push. Took me about a year to use the touch screen. I hated it. This phone is totally wasted on me.
Yeah.
I don't even know how to find internet on it. So I could, yeah, phones are for communication. And I prefer text to anything else or WhatsApp. Don't call me on it either. Because phones were meant, your phone was meant to ring when it was convenient, not all the time. So I don't answer the phone either. Okay? So age has very little effect on learning. And that's what's very important for all of you, whether you're from the clinical or the social background. Old people can learn things. You have to make them want to.
Yes.
So this means plan simple tasks, allow more time. When you ask a question, don't go to the next question. Lots of verbal clues, lots of visual clues, functional moves, etc. We do see memory loss in about 10% of our population. What is very interesting now is that yesterday I was going through one of the things has one of the journals has a series out on dementia, and worldwide the prevalence is falling. And I think that this is because we're now paying attention to midlife hypertension, diabetes. We are at 6% in Jamaica, which is not bad. That's really not bad. So the hippocampus is where you stores and retrieves, and of course proteins help. Older people will have more memory loss. Sorry, let me just see why she's emailing every minute. See, that's why I hate the phone. I'm trying to sort out a medical student trying to get a fee payment plan. See why these things intrude on you? Right, so remember that anything that aggravates blood flow is going to make memory issues worse. So anything that's going to affect blood flow, so diabetes, hypertension, high cholesterol, anything like that is going to lead to changes in cognition, in memory. Cognition is more than memory. Cognition is intellectual impairment. Because I can have no memory, but my intellect is fine. I can do serial sevens, but I won't remember that you asked me to do them. But when you tell me to take 7 from 100, I can do it. And there's a big difference between dementia and just memory loss. Because you will have it, and for people with just memory loss, you have to include them in conversations, include them in decisions. I usually just say, take a little note and write it down so you can remind them. So, memory is unaffected. You can usually do the things that you used to do, except if you have problems, of course, with arthritis, lack of energy, etc. Your innate common sense. So cognitive function, we mix up cognitive function and memory because we tend to, once somebody's forgetful, they're demented. Rubbish. 30% of people will have some memory impairment of some sort. Whereas, especially if you're between 60 and 75, it's only going to be about 4% that are going to have full-blown dementia. We do see it after 80. We haven't figured out how to reduce that yet. I suspect with the interest on midlife and reducing hypertension, we will soon impact that 80 group as well. So cognitive function is very individual. And cognitive function means that, yes, you're forgetful, but also you can't, attention span is less, concentration is less, intelligence, etc. So I hope I have got the message here that not all memory loss is dementia. And you know it's normal when people are able to function independently, they're able to recall. Then, of course, the person that I always dismiss in my head, obviously not to them, is when they sit down and they say, I'm having memory loss. If you can tell me you're having memory loss and describe your memory loss to me, then you're not having memory loss.
I'm forgetful. I'm very forgetful though.
But then can tell you everything about it. All of us will have the occasional difficulty in finding a word, but we can still hold a conversation. And if you ask me what I think, I'll still be able to give you a sound judgment. Then you have the urinary symptoms. So I hope we've done the quick overview of the nervous system, because I know it's at the root of a lot of people's concerns and fears. The bladder system is another one that gives older people problems. The bladder capacity, remember, loss of elasticity, loss of cells. So it decreases in capacity, so you go more often. And for some reason, at night. So it means too much water, because they can't get rid of it. And when you can't get rid of it, there's increase in calcium and potassium, sorry, not calcium. There is increased risk for dehydration, because what happens, a lot of older people will slow down on their intake of water because they don't want to go to the bathroom, especially if they're going out.
Cool.
And of course, drug toxicity, because they're not excreting it as quickly. The genital system, we know about the prostate disorders, but there's also the vaginal dryness, etc. And we need to remember that older people are not asexual. Because older people still have relationships. They may not necessarily have sexual intercourse, but there's talking, touching, having a conversation, being together. Maslow's hierarchy of needs. A hug, a touch. So all of these families that separate people who haven't been separated for 50 years. You know, I'll have patients in my office. Oh, you take daddy, I'll take mommy. Mommy and daddy have slept together for the last 50 years. Why are you separating them? Well, they're not doing anything anymore. No, what is anything? They are supplying each other's emotional needs.
Yeah.
And you see them sitting whispering to each other.
Yeah.
In fact, they seem to get closer after 65, and because of course there's fewer people in their world. The children are doing their own thing, etc. But please remember that the skin changes particularly happen to females. So the itching, the fungal, the heat rashes, all of that becomes significant, and the skin is thinner as well. And the blood supply is down. So it can be a very uncomfortable time of life, especially in our climate, right? Similarly with the male, and remember the prostate. And finally, unfortunately, as we talk about the physical changes, etc., we have to remember there's death and dying, that we have to understand the processes that take place, and eventually, hopefully later, you're going to get to the process of decline, which is going to lead to organs and cells shutting down. So denying death and not being able to work through death is really, it's really our own issues with death and dying. And it's you have to learn, especially the clinical, well, no, because the social work people in the social ones from the council get to know your people, work with your people, and are just as close as any of us that are clinical. And it's really, and I know you're going to think I'm crazy, but trust me, you'll get there. It's really about becoming comfortable with the dying process, and recognizing your role in helping the family. Yes, I mean, I grieve, I bawl with my people, I do everything with my people if I'm there and I'm part of the process. That you can allow the sadness, you know, and you can actually help. I'm reminded about one that I was at, and it was very interesting. Again, it was when I was younger, so now I don't offer to. So I was leaving the husband and wife alone in the room. And she said to me, "Where are you going? You're staying in here with us." And I guess she didn't want to be alone in there with him when he died. But she put everybody, and you know, I considered it such a privilege because they were very close. They had got married late. They had both got married at 40. And they had spent 40 odd years together. And she thanked him. I thought it was wonderful as she thanked him for the wonderful life that she had. And she promised him that she would be okay. And this is going on and this is going on. And I suddenly realized I don't see anybody coming to pray. So I said to her, I turned around, I said, "Sybil, did you call Reverend?" And she looks at me with shock on her. "You think it's that close? You think I really need to call him?" I said, "Yes, you need to call him." Luckily, he made it in time because I also knew they were foundation members of their church. And if she would have had such guilt if he had not had a blessing before he died. So it's you get comfortable with the process and you recognize that every process is different. There was one I knew, and she had metastases to the liver, so the liver was very tender. And the son wanted to make sure that everything was perfect. So he made me do house calls. Well, after about the third house call, she said, "Shut the door." So I shut the door to the bedroom. "You are not poking my belly today, you know. Every time you poke my belly, I have pain. But you're going to earn your money. My son is paying you for the house call, so you're going to earn your money." She had marked 3 passages in the Bible. And she told me to read her the 3 passages. And every time I came back, she had 3 different passages. So the son had no idea what was going on in the bedroom behind him. He thought I was examining her. And we're in there reading a Bible. So it's really about how you can help people. Because I'm helping the son, because he knows he's going to get his death certificate, and I'm going to have seen her. And I'm helping her in a way because she's doing what her son wants. So we're not saying to him, "You don't need to come." And she didn't tell him it was a waste of money. Or she also told me, "Well, you're young, the money will help you." So it's really about working out your own thoughts about death. And I guess it's easier to do it with older people than with younger people because at least you can focus on the life that's lived and on the contribution. But you can't talk about the physical changes of old age without mention dying. Thank you. Comments and questions? Everybody silent?
No. On the last slide, you said those who deny touching. Okay, yes, this last one. Avoid touching people who are dying. That's a form of denial.
A lot of people are afraid, you know.
Eh? A
lot of people are afraid to touch people who are dying. I tell everybody, give them their hug and their last kiss.
Really?
Oh, yes. They don't want to hurt them. They don't. I had one patient who was dying of pancreatic cancer and therefore had some pains. And he had family members that were afraid to touch him.
Yeah, I fall in that.
So I said, "But don't touch his belly. Mm-hmm. Put your arms around his upper body."
Yes, I encourage patients to do the same. Hold hands and
Yeah.
stay close because, you know.
And they hear till the last minute,
They
you know.
do, they do.
They hear until the last minute.
Even when it appears as if they're, you know, losing consciousness, they may still be
Yep,
hearing you.
yep.
I advise them about that.
I'm still not comfortable with that one because I really don't agree with that last one. I honestly, because
You don't have to agree. I'm telling you, I've been finished. So you don't have to agree.
I wouldn't say I am in denial of death for that. No, it's just that I probably may feel uncomfortable, but I'm really not in denial.
Why would you feel uncomfortable with saying goodbye to a dying relative?
I don't know.
Afraid.
I don't know, just scared. I don't know. I really don't know, but I don't.
So you don't then?
Huh?
You don't touch the person who is dying?
No.
My father and my husband died in my arms. I actually lifted them up and held them. And my father gave me the most beautiful smile.
I don't know.
They actually took a picture when my father just looked up at me and smiled.
I'd rather have the memory of how they were when they were young, they were alive. But the dying part of it, I don't think I'll be able to manage that part. And it's not denial. It's just that I don't want to.
Well, no. Oh, so I see I see what you're saying now, that it's not that you're denying it. Well, that's a different thing. But I can assure you, because in fact I have a funeral to go to on Saturday, that they denied the dying until the death took place. And at 3 o'clock in the afternoon, they told the doctor to get out the room because the child was going to get up and walk. So there was you do have people that deny, especially cancer victims, and especially younger. This person was even taken to Mexico. And the family life savings were spent. Because they said that, and in fact, the mother told me that I was not God. And only God could determine that he was in fact dying. And God had not told her that yet. So you do.
Some people that life support for a few years.
Well, that's another debate and another argument.
As well as some, there might be a religious, you know.
There's some for a religious thing. I wouldn't put any of my family members on life support. And I have a living will that I am not to be put on life support. But but it's also very important. It's a very important discussion. It's very individualistic, and you must have the discussion with if this right here. I'm not talking about family members. I'm talking about us as professionals and caregivers.
Yeah.
But it's extremely important that going to a personal level, that somebody close to you knows what you want.
Yes, I agree. And the decision also ought not to be made based on, it is such an individual and personal one. It can be made based on what you see happen in the past.
That's right.
To somebody else. You know, you have to, I don't know, but because there are so many situations that conflict each other. You know, you might see, for instance, somebody on the brink of death who
comes back
around
yeah.
from death, as well as people who you do not expect to pass away because this is a thing, it can easily be managed, etc. And they don't do well, and they pass on. So you like you're saying, Professor, it is so.
No, if I'm brain dead, definitely don't put me on life support. But my choice is mine.
Yeah.
But your choice is yours, and none is right. None is right. There's no right or wrong here. There's no right or wrong. It's absolutely no right or wrong. It's my mother wanted to go into hospital. My father said to me when he knew what he had, and he was totally manipulative, because being a doctor, I suspect he knew. And when they did the CAT scan, the doctor doing the CAT scan said to him, "Doc, what's next?" And he said, "Oh, you will tell Dr. Robbie the result. He will call Denise. She will come and tell me what's wrong." Now, my father knew I was in Kingston, eh? I am the one. So Dr. Robbie called me. He said, "You have to come and tell your father he has lung cancer." I said, "So why aren't you?" He says, "No, you are to tell him." But my father knew why he did that. Because when I told him, and I told him with the family there, he told them to get out the room. "I want to talk to her." So he told his wife and my brother to get out the room. And he looked me squarely in the face. He said, "How am I going to die?" I said, "Daddy, what sort of question is that?" I mean, at this point, he's still walking around the house. He said, "You know what I'm asking you?" I said, "Yes, you're going to die in that bed with all of us around you." He said, "Okay, fine, let's go outside now." And got the promise from me that I was not putting him in hospital, which I didn't do. I moved hospital in. But Daddy died within 2 weeks. And there was no reason for him to die. He knew exactly what he was doing. And I suspect he knew months before that he had lung cancer, because my father was a heart patient, not a cancer patient. And Daddy had his checkup in February. He'd had his chest x-ray in February. And this is May. So Daddy knew, and he avoided Dr. Rob. So people will also tell you, older people, what they want. Now, where you run into a problem if you are the professional involved is when the members of the family don't agree with the person's choice.
Yeah, that's true.
But what I am saying here is that you have to get comfortable with having the conversation. That's the message of this. There's no point saying it's not going to happen. Especially for older people, they will tell you what hymns to sing. They will plan their service.
Yep.
Is Karine still with us? She's very quiet. Karine, are you there?
Yes, I am, but my background is a bit noisy, so I turned my mic off.
Because you've also, anything you want to join us? Any comments?
No, I'm just listening intently. But I understood most of what was being said, and I agree with a lot of things. And I was listening to Bethan just now.
So it is a personal choice. The other thing that comes into that choice is somebody may want to stay at home, but the relative may not be able to handle. You're talking about strokes, and you're talking about feeding them, turning them, bathing them. So it's a number of things come into the picture. It's interesting, this morning I was having a conversation. She's a doctor who is trying to decide what's next for her in life, academically, and was thinking of doing history. But after our conversation this morning, is thinking of coming over here to do palliative care. Any other comments or points?
This doctor is a retiree.
Younger, in her mid-30s. Okay.
Thank you. We enjoyed the lecture. It was very interesting. Quick thought. Do all as we get older, as people get older, do they lose some of the social inhibitions or that sort of thing? Is it related directly only to dementia, or it can happen with memory loss? I mean,
do you know some of them do it intentionally? It's not all memory. In fact, I had one, the answer to you to start off with is yes. And they get so they just don't care. I had one lady tell me, I'm a little old lady and I can do what I want. So some of it's deliberate. Is it attention seeking? Sometimes it is. And you then have to go to I keep going back to Maslow's hierarchy of needs. And I think that a lot of times people who are doing that and they may be getting enough love and attention, but they don't think they are. So it happens with dementia and memory loss, but it also happens, I think sometimes if we could go back, I don't know this for a fact, this I'm just thinking. I suspect if you went back in the lives of those people, they were exhibitionists during their teen years. They would do things that, like jump off of cliffs and do bungee jumping, and they probably took a lot of chances as young people that others didn't take. They weren't the nerds in class, etc. They were probably the ones that were the first one in a short skirt or the tight pants, etc. I suspect if we could they lived on the edge then.
Thank you.
I often there's a movie that comes on the TV, The Golden Girls. I think everybody program. And I watched that over the years, and it gives you an understanding of what life is like as you grow older. You lose nothing. You enjoy life. You have the social life. You have the sex life. You can be fussy when you want to be fussy. And I think it is a good example for persons to really have an appreciation for yeah. And it teaches you so much about life and in terms of how do you live each day. You can get up in the morning and eat if you don't want to, make choices that you would like, and just you're not accountable to anybody, but at the same time, you respect and appreciate those persons who live within your circle. I find that movie to be an excellent movie to share with those who are very uncomfortable with that transition process. It's an excellent movie.
But as you were saying this and as he asked the question, I have a patient who, well, she's been my patient since about her 40s. She's a cancer survivor. And she is outrageous. She has on either 7 or 8 rings and, the hair. And now that you're saying it and I'm thinking, you didn't survive mastectomy and breast cancer 20, 25 years ago. And she has. So she probably started living on the edge long before, because she didn't expect to live this long. And I remember when she first came to me, she was a surgeon's patient. Thank you, because I'm doing no more mammograms. I'm doing no more of this. I'm not going to be a cancer cripple, and you will not treat me as one. And she's still coming to me, so she's still alive. And she has never repeated her mammogram. She allows me to do the breast examination. I don't know what, thank God, she's now about 75. Oh, she just got remarried. Yes, with all of these rings, and you should see, she's one of the ones out of Gobi that you would say is quite an exhibitionist. But she is a delight when you get to know her. The irony is, I was told yesterday, her son, who is obviously 20, 25 years younger, is actually in University Hospital with a stroke. And she is there all over the place. So maybe there's something to be said for these who don't care. They live life.